This is the third part of our lesson Public Health Surveillance 2. This presentation was developed by Mark Durand, Narendra Singh, Tom K. Drzinski and Hazel Clothier. Slide 39. We are linking surveillance to action for communicable diseases. Slide 40. It is a core function of surveillance is to generate urgent reporting for epidemic or serious diseases. What often does happen? 1. A report is delayed. 2. The system is bypassed. 3. Wait for off-file and lab confirmation. 4. Public is not informed until situation is clear. 5. Assessment and response is improvised. If this happens, you fail to apply Pacific Outbreak Manual step-by-step approach. What should happen? 1. An event is considered. 2. An urgent report is made. 3. The situation is quickly assessed in an organized way. 4. Response initiated without waiting for lab confirmation, based on best information. 5. Public is informed of threat and actions to take, with acknowledgement of uncertainty. Slide 41. When you reach a threshold, you can review Pacific Outbreak Manual. You might also consult a PNET team chair or medical director. You will convene a PNET team, if action is needed at hospital, laboratory, etc. You could call a regional epidemiologist. Slide 42. How do you link surveillance to action for NCDs? Slide 43. Logic map shows cause and effect connections. Generally, we think of NCD as being driven by behavioral risk factors of problem alcohol use, tobacco use and physical inactivity or junk food diets that work through obesity. Based on available information, WHO in 2012 ranked countries on obesity. 8 of top 10 were Pacific Island countries. Tobacco use and problem alcohol drinking are too high in the Pacific, but the most remarkable factor driving the declared epidemic is obesity. Slide 44. Onset of risk factors is in young children, obesity, and youth, tobacco and alcohol. We tend to think of NCDs as diseases of adults, but it is actually uptake of risks by children, youth that drives the epidemic. Slide 45. Health education, health promotion and medical care can address only a fraction of the preventable burden of disease and death from NCDs. Environmental changes through effective application of policies have been very much neglected. They are the key to reversing the epidemic of NCDs. Slide 46. Policies are the tool that we have to affect environments. Think of policies as rules. They apply at multiple levels. Family policies may be that no soft drinks are bought when shopping, that computer, TV time is limited to 1 hour for children, that there is a curfew so that all youth must be back in the home by 9 p.m. Village policies may be that one Saturday per month is a clean-up day, that only local foods are served at village functions, that teens are not allowed to hang out in parks and drink beer. Institutional policies, for example, school policies may prohibit bringing junk foods to school, prohibit school staff from using tobacco on campus, mandate physical education for 30 minutes each day. Laws and regulations may put taxes on sugar-sweetened beverages, tobacco and alcohol, restrict advertising and sports sponsorships by companies that sell these things, restrict sales to minors, etc. Slide 47. So, to see this epidemic clearly, we should add another box, environment, to our cause and effect map. Slide 48. The commitment package went through a parallel process of development, vetting, and approval and is now finalized. A one-page detail sheet is available on the www.poa.org website for each of these recommended policies. By end of September, a toolbox, containing sample, annotated regulations, laws and institutional policies will be available on the website, to make it very easy to promote and adopt effective policies. Slide 49. So we should put effective policies on our cause and effect map. Here, the policies make the environment more healthy and block the occurrence of risks, disease and deaths to the right. Slide 50. So we should put effective policies on our cause and effect map. Here, the policies make the environment more healthy and block the occurrence of risks, disease and deaths to the right. Slide 51. See you next lesson.